Hello, and welcome to this special webinar event. My name is Joshua Kroll. I am the Director of Sales and Marketing for Evexia Diagnostics. We are excited to have you with us for this very important presentation, COVID-19 Update, October 2021, Lab Testing, Vaccines, Immunity, and Nutritional Support. I am pleased to introduce my colleague, the Director of Clinical Support and Education for Evexia Diagnostics, Dr. Wayne Sodano, who will be presenting this timely information. Without further ado, Dr. Wayne Sodano.
Hi, this is Dr. Sodano. Welcome to the COVID-19 October 2021 update presentation by Evexia Diagnostics. So as you can read on the slide, I'm going to be talking about lab testing, vaccines, the immune system, and immune system nutrition. But before we get started, I want you to remember that information about the virus and vaccine is fluid, and therefore as new information presents, the information is likely to change. So I want to start out by talking about the vaccines. So as you most likely know, all vaccines work by exposing the body to molecules for the target pathogen to trigger an immune response. Now, the goal of the COVID-19 vaccines is to produce immunity to the SARS-CoV-2 virus by stimulating an immune response to an antigen that is a foreign protein, in particular, the spike protein found on the surface of the virus. Now, there are three main vaccines I'm going to be talking about, as you see outlined on the slide. There's the Pfizer and the Moderna, both of which are messenger RNA vaccines. And then there's the Johnson & Johnson Janssen vaccine, which is a viral vector vaccine that also delivers messenger RNA. Now, the chart you see on this slide lists the active and inactive ingredients of the three vaccines. So I suggest pausing the presentation for a moment and reading the list of ingredients. The ones I want to point out, particularly the inactive ingredients, are the polypropylene glycol that is found in the Pfizer and the Moderna vaccine, and the polysorbate 80, which is found in the Janssen or Johnson & Johnson vaccine. Now, here's some important additional information about the vaccine. Now, according to the CDC, none of the vaccines contain egg, gelatin, latex, or preservatives. In addition, all the COVID-19 vaccines are free from metals such as iron, nickel, cobalt, lithium, rare earth alloys, or any manufactured products. And it's important to know that both the Pfizer and Moderna vaccines contain polyethylene glycol, and that the Johnson & Johnson contains the polysorbate, which I talked about. And here's why. And that's because of the potential for hypersensitivity reaction to those inactive substances, meaning the polyethylene glycol and the polysorbate. So essentially, the COVID-19 vaccines use the cells to produce antigens. But here's how it works. There's a short fragment of the genetic code, meaning the messenger RNA, from the target pathogen, and that's introduced into the body. Now, this process is going to mimic the method for which normal viruses hijack the cell's machinery. But rather than creating copies of the virus, the cell only produces large amounts of the antigen, which in this case is a spike protein, and that's going to trigger a strong immune response, in other words, antibodies. So once the messenger RNA is inside the cell, the production of the spike protein, which is then displayed on the cell's surface, will be detected by the immune system as a foreign protein. Now, the immune response is going to include natural killer T cells, which seeks out and destroys infected cells, as well as antibody-producing B cells and T helper cells, all of which support antibody production. Now, in this slide, you can get a good look at the spike proteins on the coronavirus. I also want you to notice the nucleocapsid. And in looking at the lab testing for antibodies, I'll be talking about the nucleocapsid antibodies. So essentially, the body produces antibodies to both the nucleocapsid and the spike protein, but the vaccine produces antibodies only to the spike protein, in particular the spike protein receptor binding domain, or RBD. This is the main part of the virus that attaches to the receptor on the cell so it can enter into the cell. So I want to briefly talk about the portal of entry of the coronavirus into the cell, and that is the ACE2 cell receptor, and that can be found in the lungs and also in the GI tract. And essentially, that's the way the coronavirus enters the cell. It latches onto the ACE2 receptor on the cell membrane and acts as a doorway, allowing the virus to infect the cell. So here's a great illustration of the metabolism of the coronavirus. On the upper left-hand corner, you see the spike protein latching on to the angiotensin converting receptor 2 on the cell, and then it enters the cell. And that opens the doorway for the virus to begin hijacking the cell's metabolism to produce more virus. So let's review the COVID-19 messenger RNA vaccine process. So step one, the vaccines are given to the upper arm, and once the instructions, meaning the messenger RNA, are inside the muscle cells, the cell is going to make a piece of the protein, in this case, the spike protein. Now, after the protein is made, the cell breaks down the instructions, that is the messenger RNA, and then gets rid of it. Then what happens is that the cell displays the spike protein on the surface, which is then recognized by the immune system. The immune system then produces antibodies to the protein in a similar manner that happens in natural infection against COVID-19. Now, the Johnson & Johnson works in a similar manner, but with a little different delivery system. This is known as viral vector vaccines. Now, these type of vaccines work by inserting the genetic material, in this case messenger RNA, into a harmless or attenuated virus, which is then inoculated into the patient. Then the virus infects the cells, delivering the messenger RNA. Now, the other vaccines, the Pfizer and the Moderna, they use a technology known as nanoparticles that essentially pushes the messenger RNA into the cell. So the vector vaccines begin infecting the cells and then inserting their genetic material into the cell. Now, when the immune system detects the foreign protein on the surface of the cell, just as with the other vaccines, it mounts the same immune response that I talked about. One of the challenges with the viral vector vaccines is that individuals may have previously been exposed to the vector virus or the delivery virus and raise an immune response against it, reducing the effectiveness of the vaccine. And such an anti-vector immunity also makes delivery of a second dose of the vaccine challenging, assuming that one is needed, unless the second dose is delivered using a different vector virus. So please be aware of that. Now, currently, the CDC states that the COVID-19 vaccines are not interchangeable. However, this may be changing. This slide lists some of the common side effects of the COVID-19 vaccines. There's pain at the injection site and redness, swelling. Patient can be tired if you experience a headache, muscle pain, chills, fever, and nausea. So here's some information about the post-vaccination symptoms posted by the CDC. So I'm going to go ahead and read it. Now, before vaccinations, providers should counsel vaccine recipients about expected local and systemic post-vaccination symptoms. Although reactions vary by vaccine product, age group, and dose, symptoms generally occur usually within the first 3 days of the vaccine. They are mild to moderate in severity. They usually resolve in 1 to 3 days and occur more frequently and with greater severity following the second dose and among younger age groups. And here's some additional information regarding delayed onset local reactions to the first dose of the vaccine from the CDC. Now, delayed onset reactions beginning a few days through the second week after the first dose are not a contraindication or a precaution to receiving a second dose. When persons who experienced a delayed onset injection site reaction after the first dose will experience a similar reaction after the second dose, whether persons who experience a delayed onset injection site reaction after the first dose will experience a similar reaction after the second dose is unknown. However, such reactions are believed not to represent a risk for anaphylaxis upon receipt of the second dose. Persons with delayed injection site reactions after the first messenger RNA COVID-19 vaccine dose should receive a second dose of the same vaccine product at recommended intervals, preferably in the opposite arm. It's also important to know about the periods of observation to check for post-vaccination symptoms. And as you can see on the slide, all people should be observed for 15 minutes and for 30 minutes if there's a history of immediate allergic reaction to a vaccine or injectable therapy, if there are contraindications to a different type of COVID-19 vaccine, and/or a history of anaphylaxis from any cause. Now, the information on this slide is adapted from the March 5th, 2021 interim clinical consideration use of COVID-19 vaccines currently authorized in the United States, which shows the triage of people presented with COVID-19 vaccinations. As you can read by the titles, contraindications, precautions, and those who may proceed with the vaccination are addressed. Please pause the slide and take a moment to review these topics. Here are some additional tools offered by the CDC to help identify individuals with contraindications and precautions to vaccines. You can go to the website located on the slide and then download these forms if needed. This slide shows information from the CDC regarding those who should not get the vaccine or a particular vaccine. The main contraindication is if an individual had a severe allergic reaction, anaphylaxis, or an immediate allergic reaction, even if it was not severe to any ingredients in the vaccine, such as polypropylene glycol. You should not get that particular vaccine. But they also state that if your patients aren't able to get a particular vaccine, you may still be able to get a different type of vaccine. And like I said, I want you to be aware that there are some allergic reactions to polypropylene glycol, PEG, and polysorbate, which, as you know by now, are some of the inactive ingredients in the vaccines. Now, the Pfizer and the Moderna have the polypropylene glycol, and the Johnson & Johnson has the polysorbate 80. The CDC also has some information about allergy to other types of vaccines. And they note that if your patient had an immediate allergic reaction, even if it was not severe, to a vaccine or injectable for another disease, a doctor-patient consultation regarding this vaccine is recommended. So I know I said it before, but I just want to stress the point. Hopefully you're familiar with VAERS, and that stands for Vaccine Adverse Event Reporting System. And just right under the title is the website that you can go to. Now, the purpose of VAERS, which was established in 1990, is that it's a national early warning system to detect possible safety problems with U.S. licensed vaccines. So anyone can report an adverse event to VAERS. And VAERS is a passive reporting system, meaning that it relies on individuals who send in reports of their experiences to the CDC and the FDA. Now, VAERS is not designed to determine if a vaccine caused a health problem, but is especially useful for detecting unusual and unexpected patterns of adverse events reporting that might indicate a possible safety problem with a particular vaccine. So just please be aware of VAERS. So now I want to review some of the other side effects that I'm sure you've heard about by now. And one side effect is the association of myocarditis with the COVID-19 vaccines. Now, the information on this slide is from Johns Hopkins, and as it reads, since April 2021, there have been more than 1,000 reports of cases of myocarditis and pericarditis happening after receiving the Pfizer and Moderna vaccines in the United States. And the problem appears to occur more often in adolescents and young adults and in males. And Johns Hopkins reports that for the most case, the myocarditis or pericarditis is mild and resolves quickly. And for most of the cases, Johns Hopkins reports that the myocarditis or pericarditis is mild and resolves quickly. Now, this information regarding myocarditis and pericarditis after the vaccine is from the CDC. So myocarditis, which as you know is inflammation of the heart, and pericarditis is inflammation of the lining around the heart, have occurred in some people after receiving the messenger RNA COVID-19 vaccines. At this point in time, the mechanisms that cause these reactions is not very well understood. Now, this slide provides information about the considerations for the use of the messenger RNA COVID-19 vaccines for individuals that have a history of myocarditis or pericarditis. So I want you to take a moment and pause the slide and please read through it. Now, the information on this slide is from the Advisory Committee on Immunization Practices, the ACIP. Now, you may have heard that there might be an association with Guillain-Barré syndrome after vaccination with the Janssen or Johnson & Johnson COVID-19 vaccine. And this information is from the CDC, which, according to the Advisory Committee on Immunization Practices, meaning general best practice guidelines for immunization, they do not identify a history of Guillain-Barré syndrome as a contraindication to getting the vaccine. But once again, please keep in mind that this information is fluid. Investigation is still ongoing. Here's another study published in September 2021 regarding Guillain-Barré syndrome after the SARS-CoV-2 infection. And what was investigated was the increased number of patients with neurological disorders, including Guillain-Barré syndrome, that had been reported following the infection. And this study stated that they did not find any increase in patient recruitment during the pandemic for ongoing international Guillain-Barré syndrome outcome study compared to previous years, making a strong relationship of Guillain-Barré syndrome with the infection unlikely. However, a controlled study is required to determine if there is a causative link or not. So again, fluid situation. And I'm pretty sure you heard about the possibility of clotting from the Johnson & Johnson vaccine. And the information on this slide is from the CDC. And essentially, the study reports the onset of clots in some individuals post Johnson & Johnson vaccine, and the highest rate were women between ages 18 and 49. Another topic has been menstrual changes after the COVID-19 vaccine. Now, the information on this slide is from the UK's Medicines and Healthcare Product Regulatory Agency, and they reported that more than 30,000 cases of the event, and they reported that 30,000 reports of these events have been made to the Medicine and Health Products Regulatory Agency, what's known as a yellow card surveillance scheme for adverse drug reactions by the 2nd of September 2021. And that occurred across all COVID-19 vaccines currently offered. Now, it's been suggested that what may be causing the menstrual changes is the biological plausible mechanism linking the immune stimulation with menstrual changes, including immunological influences on the hormones driving the menstrual cycle or effects mediated by immune cells in the lining of the uterus, which are involved in the cyclical buildup and breakdown of the tissue. So I want to switch gears here and briefly talk about SARS-CoV-2 and the adaptive immune response. So as you probably know, SARS-CoV-2 is a beta coronavirus that is closely linked to the SARS-CoV, the virus that caused severe acute respiratory syndrome. Now, manifestations of COVID-19, as you probably know, include an asymptomatic infection, a self-limiting illness comprised of fever, cough, and various nonspecific symptoms. Now, antibodies to SARS-CoV-2 begin to appear during the first week after onset of the symptoms. And for a variable period of time, generally 2 to 3 weeks after onset of symptoms, there's rising antibody titers and declining levels of viral load in the respiratory tract. Now, viral-specific neutralizing antibodies and T cell responses emerge during the seroconversion time, meaning the time it takes to produce antibodies. Now, in the early phase of the COVID-19 infection, there was a strong correlation between the presence of viral RNA detected by a test called polymerase chain reaction, or PCR test. Now, here's something that I want you to key on. Emerging data from a very small sample of patients suggests that although viral RNA may be detectable in the respiratory tract for a prolonged period, the ability to isolate replicated, competent virus becomes increasingly difficult as antiviral antibodies appear. Now, what's important to know is that the detection of antibodies to the S1 protein or the receptor binding domain protein, which we'll talk about, of SARS-CoV-2 is the most specific indicator of past infection, and that antibodies to the immunogenic virus components, such as nucleocapsid protein, are also useful indicators of past infection. And I'll be going over those in testing. But you also need to be aware that a confounding factor with regard to specificity of antibodies is the degree to which they detect cross-reactivity with other antibodies directed towards an endemic or other human coronaviruses, which I have listed on this slide. So there can be some cross-reactivity, meaning the potential for false positive of COVID-2. So in summary, the incubation period for COVID-19 is thought to extend to 14 days with an average of 4 to 5 days from exposure to onset of symptoms. Now, one study reported that 97.5% of the persons with COVID-19 who develop symptoms do so within 11.5 days of infection. This is a really good slide to have on hand and maybe put at your desk because it really outlines what is going on with regard to the immune response. So let's go over this slowly here. So before the onset of symptoms, as you can see here, the blue line is a nasopharyngeal swab for PCR. The red line is the virus isolation from the respiratory tract. The purple line is the bronchoalveolar lavage or sputum PCR, and then you have the yellow is stool PCR, and then you have the IgM antibodies, which is the first one to be produced, and then the longer lasting IgG antibodies within the dotted green line. So let's see what happens here. So 1 week, so here's detection is unlikely about a week before. See, here's the infection right here. Then as soon as symptoms start, after symptom onset, from about the first week going into Past the third week, PCR is likely positive. Right after that, PCR is likely negative. Antibodies can be detected right about here, right into the second week for antibody detection. What you'll notice here, I want to point out a few things here. First, the stool. Remember, there are ACE receptors in the GI tract. And what I want to point out here is that stool PCR can pick up the virus or viral shedding all the way through the first week, second week, third week, fourth week, and as far as the fifth week, and then it begins to decline. So we'll be talking about the stool PCR test for COVID as well. Now, antibody production, the seroconversion is right about here. You first see in the purple line, the IgM goes all the way up here to this third week, and then it begins to drop off. Where IgG, the dotted line, and the green dotted line, it goes all the way up here as well into the third week and then continues long after. The test I'll be talking about will actually do a sum of both the IgM and IgG because the results tend to be better according to the research. This slide reviews what happens to the immune system, the innate and also the adaptive immune system with the SARS-CoV-2 infection. So we'll start here over on the left-hand side. There's the virus, right? It then stimulates an innate immune response, which, by the way, are natural killer cells. And then once the virus is recognized by the antigen-presenting cell, some call it dendritic cells, it starts to induce the T cells, the T lymphocytes, to produce cytokines, and they produce the B cells, which produce plasma cells, which makes antibodies. And then there's also memory cells, the T memory cells, and the memory B cells as well. So that gives you the line of innate to the adaptive immune response to take a look at. So let's take a look at the laboratory test considerations for COVID-19 and the COVID-19 vaccine response. The first test I'm going to talk about is the COVID-19 PCR test, and that is polymerase chain reaction test. Now, this test detects the genetic information that indicates an active infection and that the virus is present. And it's used for individuals who have COVID-19 symptoms or meet the test criteria established by the CDC. The sample collection is a swab of the nose or throat. And here's the current CDC COVID-19 testing criteria. In other words, who should get tested for current infection? And first and foremost are people who have symptoms of COVID-19. They also recommend most people who have had close contact within 6 feet or a total of 15 minutes or more over a 24-hour period with someone with confirmed COVID-19. Essentially, the CDC recommends anyone with any signs or symptoms of COVID-19 get tested, regardless of vaccination status or prior infection. So here's one of the tests offered by Evexia, and that is the SARS-CoV-2 Diagnostic Respiratory PCR test. Now, this uses real-time reverse transcription polymerase chain reaction technology, and it's going to detect the presence of viral RNA in the sample. Now, it's going to detect the presence of the SARS-CoV-2 viral RNA in the respiratory sample. Now, remember, this test determines current infection, but does not indicate past infection or immunity. And it uses a nasal or nasopharyngeal swab, and turnover time is 24 to 48 hours. Evexia also offers the SARS-CoV-2 diagnostic salivary PCR testing, which uses the same technology and has the same 24 to 48 hour turnover time, again, detecting for active infection. So now I want to talk about antibody testing for COVID-19, also known as serological testing. Now, it is possible to check for all three types of antibodies, IgM, IgA, and IgG, but essentially it's the IgM and IgG that are being tested here. And these are used in individuals who think they may have had COVID and do not have symptoms. Remember, antibody testing should not be used as a sole basis to diagnose or exclude infection. The first test I want to talk about is the surveillance COVID-19 immune response panel. But before getting into the details of this test, I want to briefly talk about the nucleocapsid antibodies and the spike protein antibodies just to set the tone to look at these tests and understand the interpretation. Now, the nucleocapsid IgM antibodies, they're going to rise and fall with the COVID-19 infection, while the nucleocapsid IgG antibodies remains in circulation anywhere from 3 to 6 months after the infection. And that's what I showed you on that slide that had the graph in it. Now, it's uncertain at this time whether or not the nucleocapsid antibodies prevent the virus from getting into the cell. They're still working on that according to my research. Now, the COVID-19 spike protein antibodies, they're able to neutralize the attempts made by the virus from getting into the cell. So the presence of these neutralizing antibodies can prevent or lessen the effects of future infection. Remember that the vaccines I talked about are designed for the body to create the spike protein antibodies, which is going to prevent or attempt to prevent the entry of the virus into the cell. So the COVID-19 immune response panel is going to measure both the nucleocapsid protein and the spike receptor binding domain antibodies. And one of the key things to remember is that the nucleocapsid protein antibodies, they are not going to rise in response to the COVID-19 vaccinations. Now, essentially, this test, what it does, it measures a combination of the IgM and IgG antibodies in response to the COVID-19 nucleocapsid and the spike protein receptor binding domain exposure. So you might ask yourself, why don't they differentiate between the IgM and IgG? And studies indicate that joint testing is as or more reliable than individual IgM or IgT testing in confirming COVID-19 exposure. And that's why they just put the total down of antibodies, IgM plus IgG, on the test result panel. What it's going to do is going to evaluate antibodies against the nucleocapsid protein, which I know you know by now, and it's going to provide a single positive or negative results. It's also going to evaluate the spike protein, and that's the receptor binding domain antibody, and provide both a positive and negative results and a semi-quantitative estimate. You're going to see lab test results in a moment or two. Now, this test is best for patients who want to understand if they have current infection or previous COVID-19 infection and or establish a pre-vaccine baseline immune response. And it also may help determine the individual's ability to fight the infection from off a new exposure. So let's take a look at the test results and the interpretive guide. I'm going to move slowly here because I really want you to understand this. So let's focus on this guide. So here we go. So if the test results come back, as you see here, we're going to start here. If the test results come back negative and negative, right here, negative for the nucleocapsid and negative for the spike receptor binding domain antibody, as you see here, right? The individual most likely did not have a COVID infection during the past 6 months. Now, if they are symptomatic, you want to have them do the COVID PCR testing, checking for active infection. The next scenario is the nucleocapsid antibodies are positive and the spike receptor binding domain antibodies is negative. What this test results means is that it's possible that there was a COVID exposure over the past 6 months or an infection without a vaccine. Remember, the vaccines are going to initiate the spike receptor binding domain antibodies. So you need to keep that in mind. And once again, if they are symptomatic, you want to refer them for a COVID-19 PCR test to check for active infection. The next scenario, we have a negative nucleocapsid antibodies, meaning negative IgM and IgG, but you have a positive spike protein receptor binding domain antibody test. So what does that mean? That means successful vaccine response. But there's also a remote chance that they had COVID but did not develop the nucleocapsid antibodies. So you need to keep that in mind. Once again, if there's symptoms, you want to consider doing that PCR test. And the final interpretation on the bottom is a positive nucleocapsid antibody, IgM, IgG total, and a positive spike protein receptor binding domain antibody, IgM, IgG. So if your lab tests come back as you see it has right up here on the lab test results, positive and positive for both the nucleocapsid and the spike RBD, right? That's going to tell you that there was exposure to the COVID virus during the past 6 months. And the test results also can indicate a vaccine response as well due to the production of those spike proteins. Now, in regard to the reference range, the nucleocapsid is qualitative, meaning positive or negative, but the spike protein gives you a semi-qualitative, meaning that it will show negative if it's less than 0.80 units per ml, and anything over that is going to be positive. And it's my understanding that they only go as far as 250 uh, units per ml. So if it's anything more than that, there'll be a greater than sign. So essentially, you can use this test as a timeline and for a vaccine response as well. So now I want to talk about the surveillance COVID-19 vaccine response test. And as you probably would have guessed, it only measures the antibody response to the spike protein receptor binding domain, because that's the protein that is made by the virus, or the foreign protein that is made by the messenger RNA viruses for the body to raise an immune response to. And essentially, it's best to wait about 3 weeks post-vaccination to allow for antibody production, or as you know by now, it's called seroconversion. However, the strongest antibody response will likely be seen after the second vaccine dose, about 6 to 8 weeks after the first inoculation. So in summary, the COVID-19 vaccine response screen is going to evaluate for that spike protein I talked about, antibodies, and it's going to provide a positive and negative results, and then it's going to give you a number. And this test is good for those who are fully vaccinated. If you want to see if they were able to make the spike protein receptor binding domain antibodies. But again, you can use the immune response panel as well. Now, just for clarification, I want to give you a little bit more information about the spike protein receptor binding domain. Now, the COVID-19 spike protein receptor binding domain, as you know by now, it binds to that ACE2 receptor, and that's going to allow entry into the cell, as I talked about earlier. Now, higher levels of these antibodies has been shown to block or neutralize the COVID-19 virus from getting into the cells and then causing the infection, as I showed you earlier. Now, individuals who have recovered from COVID-19 viral infection usually have high levels of these type of antibodies. And essentially, the neutralizing ability of these antibodies is why all three emergency use authorized vaccines target the spike protein receptor binding domain. So that's the take home for that. Sometimes I get asked, why measure the spike protein receptor binding domain antibody separately? And studies indicate that the spike protein and nucleocapsid protein antibodies elevate in response to the COVID-19 virus exposure. Now, these antibodies are not as specific as the spike protein RBD antibodies for preventing COVID-19 infection or reinfection. And that's the point of, to make it clear, that you're specifically looking for the receptor binding domain antibodies. There are spike protein antibodies, by the way. Now, we look at the test results for this individual. You can see that the spike and the nucleocapsid IgM and IgG were negative. So this individual was likely not exposed to COVID. The nucleocapsid, again, was negative here, but the spike protein receptor binding domain spike antibody here, right, was positive. Successful vaccination. It may also be a good idea to combine a pre and post vaccination assessment, which means ordering the immune response panel prior to vaccination and then ordering the vaccine response to see how much response that you got from the spike protein receptor binding domain. Evexia Diagnostics also offers a COVID-19 SARS-CoV-2 antibody IgG spike. Now, this is not the receptor binding domain antibody if you want to test that. And this is a serological test, and it should not be used solely to diagnose or exclude a recent SARS-CoV-2 infection. It's recommended in individuals at least 10 days post-symptoms onset or following exposure to individuals with confirmed COVID-19. The other test, which I think is a really good test to consider because of the amount of GI symptoms, and again, remember that the GI tract has those ACE2 receptors in it, and the SARS-CoV-2 likes the GI tract as well as the lungs. So you definitely want to keep that in mind. Now, as it reads on the slide, studies have shown that the SARS-CoV-2 virus may be found in the stool of up to 53.4% of COVID-19 patients and can be detected in the stool for up to 5 weeks after clearance from the respiratory tract, which is when I showed you, if you remember that graph that I had showed you. Now, since the coronaviruses can cause gastrointestinal symptoms, COVID-19 stool testing may be helpful as a non-invasive way to test and monitor the presence of the virus in the GI tract. Now, this is not a diagnostic test for current COVID-19 infection, but it can be utilized to screen and monitor GI viral shedding of the SARS-CoV-2 virus in confirmed COVID-19 patients in order to help prevent transmission of the virus via the fecal route. And once again, remember that there are those ACE receptors in the GI tract. And here's an article that really elucidates this point about the necessity of stool examination in asymptomatic carriers as a strategic measure to control further spread of SARS-CoV-2. It's a really good article. And like it reads in the body of the paragraph here, the highest expression of the ACE2 receptor is observed in the lungs, arteries, heart, kidneys, and also the enterocytes throughout the ileum and the colon, which may increase the probability of replication of the virus in the intestine, shedding in the stool, and further distribution of the SARS-CoV-2 in the environment. Now, this article was written in 2021 that discusses the GI symptoms and how they are common in COVID-19 patients, and how immune irregularities associated with inflammatory bowel disease share cellular components with immune responses in COVID-19. So now I want to switch gears and talk about functional medicine testing and nutraceutical immune support. So aside from the lab tests that I just mentioned a few minutes ago, there are other significant lab tests associated with COVID-19 infection, such as some of the findings you see on these slides. There's abnormal liver enzymes, high neutrophil count, low lymphocyte count, and an elevated C-reactive protein showing infection. And here's an article that discusses a case for ordering the complete blood count. And it states that some hematological parameters transform into patients with COVID-19. Now, upon disease aggravation in patients with COVID-19, the lymphocyte count, meaning the absolute lymphocytes, decreases significantly. And it was reported that the absolute lymphocytes in patients who die is significantly lower than that of those who survive. In addition, it's important to look at the red blood cell distribution width, or the RDW, because this RBC indices is significantly increased with the severity of COVID-19 infection. So in my opinion, we should be ordering a CBC as a preventive measure and also as a monitoring measure for the health and wellness of our patients. This is a wonderful article that discusses the validation of the red blood cell distribution width as a COVID-19 severity screening tool. In other words, nutritional deficiencies related to anemia arising from iron deficiency, folic acid, B12 deficiency can result in higher RDWs, which may be related to the severity of the infection. And here's another article that discusses how the lymphocyte count and the mean corpuscular hemoglobin may have an independent effect on the severity of COVID-19 risk. Now, I want to read part of the quote on this slide. Our findings have revealed the risk role of direct bilirubin and mean corpuscular hemoglobin and the protective role of albumin, white blood cell count, neutrophil count, and lymphocyte count on severe COVID-19 in the European population. Another reason why you want to order these basic but all important tests, the CBC, Comprehensive Metabolic Panel, extremely important to see what is going on with our patients, especially from a preventive medicine perspective. Now, in regard to immune system function, it's important to take a look at oxidative stress and whether or not the individual has chronic low-grade inflammations, especially in the lungs, and that can contribute to the overall decrease in immune system function. Now, oxidative stress can worsen lung function outcomes by increasing the level of various immunosuppressive substances in the lungs and dampen the response to the environmental antigens. Now, some of the analytes, as you see on this slide, one is in the blue text box on the left. That is a blood chemistry, inflammation, oxidative stress markers to consider. GGT, gamma glutamyl transferase, CRP, homocysteine, fibrinogen, ferritin, and the erythrocyte sedimentation rate. You can also test the urine for what's known as F2 isoprostanes, which, when elevated, indicates oxidative stress. Now, this is one of the great panels offered by Evexia Diagnostics called the Evexia Complete Wellness Panel. And there's many, many analytes in this panel. Very, very good panel. As you can see, the highlights here are the complete blood count, comprehensive metabolic panel, looks at the thyroid panel, iron panel, the analytes that I mentioned for inflammation. I have the slider in here, the ferritin, fibrinogen, GGT, homocysteine. They're all in here, so you definitely might want to consider ordering this panel or one of the other Evexia wellness panels. They're very well put together. Now, in this panel, as we separate it out, you can take a look at the reasons why I have suggested this. First, the CBC is going to check for anemia and the white blood cell count, in particular looking for high neutrophils and low lymphocytes. CMP is going to assess, the comprehensive metabolic panel is going to assess for an elevation of the liver enzymes, which I talked about or can be associated with COVID-19 severity. It's going to look for elevated C-reactive protein, an indicator of inflammation. It'll look at adrenal stress, looking at cortisol and DHEAS. Remember that the adrenals are connected to the immune system function. So it's important to take a look at these two analytes. Vitamin D levels, I think most of you know about vitamin D and how it helps the immune system. If low, it can indicate immune system dysfunction. Also checks for renal function. Remember, these ACE2 receptors are found in the kidneys as well. Thyroid function, we need good metabolism for overall health and also to fight off this infection and keep the immune system up and running. GGT, gamma glutamyl transferase, is an enzyme that is associated with liver and gallbladder. You may also want to consider ordering whole blood glutathione as well as an add-on to this panel. Now, the panel I showed you on the previous slide was the Evexia Complete Wellness Panel. This is the Evexia Comprehensive Wellness Panel that has many more analytes added to the panel. Now, these analytes, they're going to include the ones you see in the blue text box. You're going to see coenzyme Q10. Now, remember, that's important for mitochondrial function. It's also important to create ATP. It's also needed for cholesterol as well. The next that's added to this panel is the F2 isoprostane creatinine ratio, and that's going to assess oxidative stress. Also included is the omega-6 and omega-3. It's important to have proper balance of fatty acids because they're needed for proper inflammation response and anti-inflammatory response. B12 and folate, as you know, is needed for proper methylation, and it's also needed for proper blood cell production, meaning red and white blood cells. Zinc is, as you know by now, is essential for the immune system function. So we'll take a look at RBC zinc. The next test that's on here is the emanated gliadin antibodies, IgA and IgG. So what's important about those? Now, the detection of these antibodies certainly is going to aid in the diagnosis of gluten-sensitive enteropathies, such as celiac disease and dermatitis herpetiformis. But you may not know that gluten sensitivity and celiac disease have a tendency to lower immune system function, which kind of makes sense because it's affecting the GI tract, so you're having malabsorption. And here's a list of the other test considerations as it relates to immune system function. So I want to review them one at a time. Now, I've already talked about CBC and the comprehensive metabolic panel and cortisol. So let's take a look at these other tests that are outlined on the slide, and we'll go one by one here. So first of all, this test is called the eosinophilic cationic protein, or the ECP. It's also known as the ribonuclease 3. Now, the point about this test is that neutrophils, they're effector cells that play a role in allergic and non-allergic inflammation, as you probably know. Now, studies suggest that ECP can play a role in regulating mucosal and immune cells and may directly fight parasites, bacteria, and also viral infections. Next is the influenza A and B antibodies, quantitative. Now, this test will detect, as by its name, antibodies to influenza A and B. Next is the interleukin-2 serum test, and interleukin-2 is a cytokine produced primarily by activated T lymphocytes. So it can give you an idea of what's going on with the T lymphocytes as it relates to immune system function or dysfunction. Next is the immunoglobulins quantitative IgA, IgG, IgM test. And what that's going to do is going to take a look at the body's ability to produce antibodies. Remember that proper nutrition is needed. There can also be genetic defects that prevent normal antibody production, such as primary secretory IgA deficiency. So you can take a look at what's going on. Is the immune system working? Are they able to produce these antibodies in the first place? Is there some dysfunction, protein malabsorption, protein deficiency somewhere down the line? The next analyte is Manus binding lectin. Now, this substance is produced in the liver and is secreted into the blood. And what it does, it plays an important role in the innate immune response against invading organisms, meaning viruses, bacteria, fungus, and parasites. The next test you may want to consider is known as MPO, or myeloperoxidase. Now, this enzyme plays an important role in the innate host defense mechanisms and is present in the leukocytes, and it catalyzes hydrogen peroxide, which is a potent antimicrobial. Next is the natural killer cell and activated T cell profile interleukin 2 receptor. Now, combining these two tests will give you an assessment of the T cells and also the natural killer response. Now, remember that these natural killer cells are the ones that can destroy a virus, also cancer cells, via innate immune system. So you get an idea, are there enough of these natural killer cells available to knock out this virus? Do we need to support natural killer cell nutritionally, which can be done by substances such as vitamin A? So it gives you some really good information. The next test is neopterin. Now, what you need to know is that measurable levels of neopterin have been detected in both the serum and urine of patients suffering from various types of malignancies, but also viral infections. Another test consideration is the respiratory pathogen profile PCR. And this test is going to provide simultaneous qualitative detection and identification of multiple respiratory, viral, and bacterial nucleic acids in the nasopharynx swab. So, are there other things going on in the nasopharynx aside from the potential for COVID? The next test is known as tumor necrosis factor alpha. Now, this is an immune system chemical messenger or cytokine that is going to be elevated in infections, autoimmune disease, and has been associated with viruses. Next is vitamin A. Now, the body must acquire vitamin A from the diet in order to sustain the normal physiological processes. And that's going to include maintaining healthy skin and barrier function, vision, but also immune function, and also natural killer cells, by the way. The next test to consider is vitamin C, and we all know that vitamin C is an antioxidant, but vitamin C is also important because it stimulates the production of white blood cells. Now, the other test, vitamin C with dilution. Now, that test is used for patients that are on high dose vitamin C. An example would be individuals that have on cancer therapy doing high dose vitamin C. And the reason why you want to order this one over the regular vitamin C test because you're going to expect high doses of vitamin C because they're on vitamin C therapy. Another test to consider from a nutritional perspective, which is known as the ION test, and that stands for Individual Optimal Nutritional Test. Now, this profile, what it's going to do, it's going to analyze over 125 key nutrient biomarkers, and it's going to give you ratios of those biomarkers and may help identify nutritional shortfalls that may be the root cause of complex chronic conditions. Now, it's going to evaluate for organic acids, fat-soluble vitamins, coenzyme Q10, homocysteine, oxidative stress markers, nutrient and toxic elements, fatty acids, and amino acids. So it's a pretty good test. And here's a look at the easy-to-read report that you can share with your patient as it looks at those analytes. The next test is the Nutraceutical test, and you can order one of two. First is the first morning void, and the other is the plasma, and I'll explain the difference in an upcoming slide. Essentially, this is a nutritional testing tool, and it's going to also assess for complex chronic illness as well as those who seek improved health. Because what it will do is give you targeted, personalized nutrition, that biochemical individuality. It's going to look at the antioxidants, B vitamins, minerals, essential fatty acids, and the need for digestive support. Now, the difference between the two, the plasma and the first morning void, you want to go more towards the plasma if there is mood or neurological disorders, neurobehavioral disorders. If the patient has more symptoms of digestive disorders, you want to look for the first morning void, which looks at urine amino acids as opposed to fasting plasma amino acids, which is on the plasma profile. So that's the difference between the two. And here is the sample report, very easy to read. There's great explanations of highs and lows of the antioxidants, B vitamins, minerals, vitamin D, and etc. It also shows the Krebs cycle, energy production, potential for nutrient deficiencies. Pretty good test, as a great explanation as well. The next test you might want to consider is known as the metabolomics test plus urine. Now, this test is going to provide nutritional information. Now, this test is the first morning void urine collection. And you can also add on a blood spot finger stick and also a buccal swab. And it's going to give you information on the antioxidant needs of the patient, B vitamins, minerals, digestive support, amino acids, and common clinical indications for this test, as you see on the slide, is going to include mood disorders, mitochondrial dysfunction, fatigue, chronic stress, and inflammation. Important to take a look at. And once again, an easy to read report. It provides an assessment for the need for antioxidant support, a need for mitochondrial support, the amount of toxic exposure, and also the need for methylation. Now, we all need that, and we all know at this point that methylation is needed for the production of RNA, DNA, neurotransmitters, proteins, detoxification, as well as protecting the DNA. Now, as I mentioned earlier, oxidative stress can be directly proportional to the increase in severity of COVID-19 infection. So here is a test that you may want to consider called the oxidative stress analysis test. Some of the markers on this test are going to include lipid peroxides, and they're going to reflect oxidative damage to polyunsaturated fatty acids, which are the components to cell membranes. We want to make sure those cell membranes are healthy. It's also going to look at 8-hydroxydeoxyguanosine, and that's going to reflect oxidative stress to the DNA. And both of these are going to allow for a quick determination of the need for antioxidant support. And here's the sample report, easy to read for the highs and lows. Next test I want to talk about is known as a SpectraCell test, micronutrient test. Now, this test, what it's going to do is going to test the lymphocytes, and it's going to provide an accurate measurement of long-term functional need for vitamins, minerals, amino acids, antioxidants, and carbohydrate metabolism, as well as fat metabolism and other analytes. And here's a look at part of the end report of the SpectraCell micronutrient test. As you can see on the top, these are the results at a glance. It is going to assess functional deficiencies of the lymphocytes, and it's also going to suggest supplement recommendations as well to replete the body with the deficiencies that were found. What's also included on this test are two different values that I want to talk about. One is the Spectrox and the other is the Immunodex. Now, the Spectrox, that's going to assess the overall antioxidant function of the lymphocytes. It's going to give you a percentage of the total antioxidant measurement and not just one or two specific values. So in this case, you can see it's average, it's in the average, so doing okay. If it gets down here, it's deficient, there'll be a red dot to signify that. What that's going to allow you to do is to assess for early intervention to correct deficiencies and to promote health. And again, it plays a role in prevention. So in this case, I think I may want to give the individual a little bit more. I like to get them a little bit higher and get them in the strong antioxidant, especially these days. So the next is the Immunodex. Now, what that is an indicator of the patient's T lymphoprolific response to mitogen stimulation related to the response of a controlled population. It's something that was developed by the SpectraCell test. Basically, here's what it is. The Immunodex is an indicator of how well the individual's T response or T lymphocytes are functioning by the measure of their response to growth. And that's really what that means. These, in this case, this is in the red zone. So the immune response is not that good, a little bit deficient. So we need to take care of those deficiencies, make sure the gut is working properly and so forth. That is what that's going to tell you. So now I want to talk about nutraceutical support for the immune system, in particular Avexia Nutraceuticals. And remember, it says on the slide, currently there are no natural medicines approved by the FDA to specifically treat COVID-19. So please keep that in mind as we go through these slides. First is a wonderful article I want to share with you. It is a review of micronutrients and immune system working in harmony to reduce the risk of infection. This article came out in 2020, and it really gets down to the nitty-gritty of what micronutrients are needed to help keep the immune system up and running. And you can see I've outlined them on the slide: vitamin A, D, C, B6, B12, folate, zinc, iron, copper, selenium. They all play a vital role. And this is a great article for you to review, also share with your patients as the foundation for promoting nutrition to keep the immune system running properly. Now, the first nutraceutical I want to talk about, offered by Avexia, is the Immune System Essentials. Now, this nutraceutical has herbs, it has mushroom extracts, and other compounds that are going to help maintain a normal immune response in the body. And here are some of the key ingredients that I've outlined for you. Androgophis, and that's known to help fight viruses, reduce inflammation, and stimulate the immune system. Echinacea, which can act as an antioxidant and help stop the growth and spread of viruses and other microbes. Elderberry is also in there as well, and that can help with relief of cold and flu symptoms. Next is vitamin C, and I think we all know about vitamin C. This also has flavonoids in it as well, and vitamin C is needed to support the immune system, as you know, and also, as I mentioned earlier, to help support proper WBC production. And here's a list of ingredients in this supplement. There's one capsule has 600 milligrams of vitamin C. Also has in arceola, citrus bioflavonoids, rutin, and quercetin. Quercetin's a good antioxidant. Next is Silver Max, and this is a non-toxic form of silver that has broad spectrum effects and supports the immune system. Again, it does not interfere with antibiotics. And here's the label. It's 75 micrograms of purified silver per teaspoon. Next is S-acetylglutathione complete. And this supplement contains N-acetylcysteine, N-acetylglutathione, as well as vitamin B6. And glutathione is an extremely potent antioxidant, as you probably know, and protects against free radicals. It also protects against the lungs. The lining of the lungs contain quite a bit of glutathione, so we need to maintain proper levels. And here is the label and the ingredients. Next is Antioxidant Complete. Now, this is a comprehensive antioxidant formula. It contains herbs and spices, curcumin, garlic, ginkgo, tocopherols. It's a really good quercetin, clove, lycopene. It's a wonderful mixture. Like I said, it is complete. And here's the list. If you want to pause the slide and take a look at the list of antioxidants that are extremely important to have to support lung health as well. The next nutraceutical is called Zinc Max, and this particular formula provides 30 milligrams of chelated zinc. And as you already know, zinc is needed for proper immune system function as well as other functions in the body. And here's a list of ingredients in each capsule. As you can see, there's 30 milligrams of zinc, there's B6, riboflavin, as well as molybdenum. Next is Multi-Complex Plus, and this is a highly absorbable full-spectrum multivitamin, and it contains chelated minerals and is iron and copper free. And here's a list of ingredients for this multivitamin, which I believe is very well formulated. Next supplement is Essential Protein Beef Plus. Now remember, protein enhances and supports the function of the immune system. You've got to have enough protein to make antibodies and also to make white blood cells. So you may want to supplement yourself or your patients with little extra protein these days to keep the immune system up and running, make sure we have the proper amount of white blood cells as well as antibodies. And here are a list of ingredients for your review of the Essential Protein Beef Plus. The next supplement is known as Monolaurin Max. Now, this supplement contains monolaurin, which is a form of lauric acid. And you may recall that lauric acid helps break the lipid coating on viruses. And remember that the coronavirus has a lipid coating on it. And here is a list of ingredients for this supplement. You see that 2 capsules contain 1 gram of monolaurin. Next, I want to talk about vitamin D. And vitamin D is extremely important, not only as it relates to healthy bones and getting calcium into the system, but also for the immune system. Now, the literature supports the use of vitamin D as an immunosupportive vitamin. So the supplement I want to talk about is vitamin D 5000 plus. This formula also contains vitamin K. And you may recall that vitamins D and K are essential for bone health and arterial health and for keeping the immune system in proper balance. And here's the list of ingredients per capsule. You see vitamin D, that's cholecalciferol, 5,000 IUs, and then vitamin K as vitamin K1 and vitamin K2. Next is melatonin. And I'm sure you know that melatonin is a hormone. It's produced by the pineal gland in the brain, and it helps regulate circadian rhythms. But I think what's important to know in regard to this presentation is that some researchers recommend studying melatonin's effect on COVID-19 because of its reported anti-inflammatory, antioxidant, and immune-enhancing properties. So Avexia Nutraceutical has a supplement known as melatonin slow release, and it provides 6 milligrams of the hormone melatonin in a sustained release tablet. And here's the label for it. The next supplement is known as Immuno-Choice Liquid, and as it reads on the slide, research suggests that certain herbs, mushrooms, and other natural compounds have the ability to support normal immune function, such as natural killer cells, which are extremely important for this virus because that's the innate immune system, the first line of defense, attacking the virus and trying to get rid of it, as well as cancer cells. Now, what's in here is elderberry, astragalus, shiitake, and maitake mushroom, as well as beta-glucan. So really good formula. Next is magnesium malate chelate, and I think we all know the importance of magnesium. It's involved in over 300 chemical reactions in the body. It helps control blood sugar regulation for diabetes. We need it for bones. We need it for detoxification. So we want to make sure that we have proper levels of magnesium, and this is a great supplement to take. And here's the label. This article talks about the effect of quercetin supplementation on lung antioxidants after experimental influenza virus. The take-home message here is because quercetin restored the concentration of many antioxidants, it is proposed that it may be helpful as a drug in protecting the lung from the deleterious effects of oxidative-derived free radicals released during the influenza virus infection. This is extremely important, and I think these days it's important to take a look at this particular supplement because I believe, based on research, that it helps keep the antioxidants support in the lungs, which is important for keeping the lung barrier healthy. So take a look at this as well. Please take a look at this article. Here is the supplement known as Quercetin C, and it has flavonoids in it. And this supplement contains, obviously, vitamin C and quercetin. And here's the list of ingredients. It's vitamin C, ascorbic acid, 500 milligrams, and quercetin. Vitamin C is actually going to help with the absorption of quercetin as well to get it into the body, which is why they're put together in this formula.
Thank you, Dr. Sodano, for that excellent information. You can order any of the Avexia Nutraceuticals mentioned by Dr. Sodano or select from our expanded catalog at avexianutraceuticals.com. Please note that if you already have an Evexia Diagnostics account, you do not need to create a new account and can simply use your login credentials to view pricing and place an order. Do you have clinical questions or need additional help? Dr. Sodano is available through our Ask the Doctor service to assist you and provide the clinical support you need. You can order any of the tests covered in this presentation by following these simple steps. First, log into your Evexia Diagnostics account and click on the Test menu link. Next, use the Test menu to locate the desired tests. You can use the Evexia Link ordering tool for conventional testing, or the Add to Cart feature for specialty kits. Assign testing as appropriate to your patients, and submit your order. We are happy to assist you with any issues or questions you may have, and can be reached during our business hours between 8 a.m. and 8 p.m. Eastern Time at 888-852-2723, Monday through Friday. You can also contact us anytime via email at info@avexiadiagnostics.com. Thank you again for joining us for this special webinar event. Until next time, from everyone at Avexia Diagnostics, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.